Hi everyone, thank you for tuning in this video. Today I'm gonna talk about some basics in the dental terminology. So, the first term that I want to talk about is called dentition. A dentition is a term that is used to explain all the teeth in the mouth together. Well, all the teeth in the mouth together are referred to as dentition. Within our lifespan, we have two dentitions. So what you see on the screen right now is the primary dentition, and that dentition is replaced by a secondary dentition, which is called permanent dentition. The best way for you is to stay and stick with the term permanent. Sometimes, although I know it's referred to as secondary dentition, but when you say permanent dentition, I think everybody knows what you're talking about within the dental world. Now, all teeth within the mouth, here on the picture, they stay in the jawbone. We have two jawbones. The upper jawbone is called maxilla, and the lower movable jaw is called the mandibule. Now, when we talk about dentitions, they can be complete and incomplete dentitions. Now, the complete primary dentition has 20 teeth. 10 in the upper and 10 in the lower jaw. So let's just say that this here is the maxilla and lower is the mandible. And when it's complete, it has 20 teeth, 10 in the upper, 10 in the lower jaw. The next term that I want to talk about is called quadrants. Basically, each jawbone can be divided in two quadrants. So the upper jawbone or the maxilla is divided in upper left and upper right quadrant, and the lower jawbone is divided in lower left and lower right quadrant. Now, all of these jawbones you can see on the picture. So here is 1, 2, 3, and 4th quadrant. All of these quadrants, they have each 5 teeth. The primary dentition is also called the deciduous dentition because all of the primary teeth will be replaced by the age of 12 or 13. But the next thing that I want to talk about is teeth classes. And teeth classes refers to specific groups of teeth within the mouth or within the dentition. Here, I colored the incisors in red, the canines in yellow, and the molars in green. And when we talk about dentitions, as I mentioned, they can be complete primary dentitions or incomplete primary, but in order for you to remember all the teeth classes and how many of them there are, there's an easy formula. Basically, ICM stands for incisors, canines, and molars. And here there are the number of teeth within each class. Basically, everything's 2 except the canines. Okay, that's it for the primary dentition. Now let's move to the permanent dentition. This dentition is the dentition that stays throughout our whole life. And yeah, it's also divided in quadrants, but basically now we have 8 teeth in each quadrant. Let me just see what's going on with my presentation here. Okay. So now you see all the teeth here, and they're also divided in the same teeth classes as the primary dentition. So you have the incisors in red, the canines in yellow, and the molars in green. Now, there's a reason why I left the molars so low, because there's another group of teeth that I want to talk about, and it's called the premolars here in blue, the blue area right here. What is very important about the premolars is that the premolars grow on the space of the molars of the primary dentition. So this area right here where the molars are is how much the jaw grows between the primary and the permanent dentition. One more way you can divide the teeth is to anterior and posterior teeth. So here colored in red is the anterior teeth and colored in blue are the posterior teeth with a red margin. Basically, the easiest way to remember it is that the anterior teeth don't have chewing surface, which I'll talk about tooth surfaces after this slide. Or you can say that anterior teeth are incisors and canines and everything else is posterior teeth. What else I can say here? For example, that it's wrong to refer to the premolars as anterior teeth, even though sometimes they can be very close to the anterior, but yeah, it's wrong. So premolars and molars are posterior teeth. When you get into the tooth anatomy, and I hope to make videos someday on each tooth anatomy, we are talking about tooth surfaces. So the first surface that I will talk about is the outer surface. And basically it refers to the surface of the tooth towards the face. The easiest way to know which surface I'm talking about, well, here I have an arch sort of explaining which surface that is, if it makes any sense. This is the surface that you usually see on people, depending on their height, I mean, but you usually see when they smile. It's called facial surface because it's towards the face. And it's also referred to as labial surface or a buccal surface. It's called labial surface for the anterior teeth because it comes from the lips. Lips are called labia in Latin. And it's a buccal surface, you usually use it for posterior teeth. So it's very wrong to say labial surface of a molar. Now, of course, if there's outer surface, there must be an inner surface of the teeth. And here, as an inner surface, we see a mandible. This is a posterior view of a mandible. And I colored the inner surface of the teeth in red. This surface is referred to an oral surface, and you can use this term for everything. It's not wrong to use oral surface for upper or lower teeth. You can also use palatal surface, or you can call it lingual. Now, palatal surface is referred to the upper teeth, so the teeth in the upper jawbone. Lingual surface is usually referred to as the surface for the lower jawbone or the mandible. The next surface on the list is called chewing surface. Now, the chewing surface, the real terminology for it is occlusal surface. It's not wrong to say chewing surface, but it is wrong to say chewing surface for the anterior teeth, because anterior teeth don't have chewing surface, they have cutting edge or incisal edge. The chewing surface is only present on premolars and molars. The next surfaces of the teeth are called proximal surfaces. And proximal surfaces refer to the surfaces where you can enter basically with dental floss, or the definition would be proximal surfaces are the surfaces next to the adjacent teeth. Depending whether the tooth surface is towards the midline, which is here in white, it can be either mesial or distal surface. So when you see one of the teeth here, the side of the tooth which is closer to the midline here is called a mesial surface. So the incisors, they both have mesial surface next to each other, and that's happening only for the incisors. Everything else, the distal surface of the first incisor is the mesial surface of the second incisor, and the distal surface of the second incisor is the mesial surface of the canine. It's actually very easy. One more thing that I wanted to show you with an example for the proximal surfaces. Let's say here on the left, this is the mesial side. So this is the midline, and here it's the distal. Now you can see there are only two things that are marked here. There's the mesial surface and the distal surface. Everything on a tooth which is closer to the midline, the line that we talked before, is a mesial side. And everything which is further away from this line, so let's just say you have one side here and one side here. So this side would be the distal because it's further away from the midline. And each tooth has mesial and distal side surface. So the distal surface of one tooth automatically becomes the mesial surface of another. The next term that I want to talk about is angles. Basically, angles or junctions is where two surfaces meet. So imagine this as being one 3D platform where you have the sides here, which is mesial is always opposite to distal, and buccal is always opposite to lingual or palatal. This can also be oral surface. And here you have a tooth. Now, the place where two surfaces meet is called an external line angle. Here is one external line angle, and this is the bucco-distal. Here is another, and it's distal-lingual. And here is another, which is where the occlusal line meets the lingual line. Where the occlusal surface meets the lingual surface. So now this would be the mesiobuccal line. And here it's very important that usually mesial or distal is used first, then facial and lingual are being used, and lastly it's occlusal or incisal. So for example, this line here would be linguoincisal. And now finally we can divide the tooth in thirds. So let me just draw a tooth here. This is the crown, and here's the root of the tooth. Now, if you take these two horizontal lines, you divide the two horizontal lines, you divide the tooth into thirds. The upper third is called incisal or occlusal third. You use the term incisal when the tooth doesn't have occlusal surface, so you use it for canines and incisors. Then you have the middle third, this will stay the same, and cervical third, because it's close to the neck or the cervical line of the tooth. Now, you can also divide the tooth into thirds vertically, and then you just have mesial third, middle third, and distal third. It's actually quite simple. Now, one more thing about the thirds. If, for example, this is the labial side, and and this here would be the lingual side. You can also divide in labiolingual direction the tooth into thirds, and then it's going to be labial or buccal third. Let me just remove this. Then middle third and palatal or lingual third. So depending on which direction you are looking at the tooth, it can be divided into thirds. Finally, thanks for staying with this video till the end. I'll put probably a link for the part 2 of the terminology. If you enjoyed, please like and subscribe. The material that I used, well, basically one book that I used for to prepare myself for this presentation, I'll put it in the description. I'll post the link to Amazon or somewhere else, and hope to see you in the next part 2.